monthly meeting for June on June 4th. And I think to get started, we'll do somewhat of a roll call and make sure we confirm attendance. So I'm going to go down the list, what we think we have. So we have Connie Young.
Yes.
Thank you, Connie. Good morning. And then we have Kelly McCracken.
Yep, I'm here. Thank you.
Great. And Whitney.
I'm
from
here.
Weld County.
Yep, I'm here.
Thank you. And then Monica Wolf. Monica, you might be in and out of muting. Pretty sure Monica's on the call, so we're going to just call her.
I am.
And
I'm
then
here.
we had, looked like Glenda Mitchell added. Glenda, are you on the call? I saw her name pop up. And then Susanna from Clinica Tepia.
Hi, good morning.
This is, I'm sorry, who?
Hi, good
Who was
morning.
the last person? Okay, great. Thank you. Anyone else that I haven't mentioned, or is Glenda Mitchell out there somewhere? All right, and then I will also, myself, Mary Pat Gallis from COA, and our faithful recorder here, Cheryl Wakefield, is also here from COA. So is there anyone else I did not call? I did hear from Ellen Filstrom from the University of Colorado in Fort Collins that she would not be able to make the meeting. I do know Melissa Pruitt will not be able to make the meeting, and Meredith Coog was not able to make the meeting. So those are the only ones I absolutely know about. So if you add to the call, let me know. We'll kind of watch for that. So we're going to officially get started. All right, so here's our agenda for the day. We have done our introductions and announced that it's recording. We'll have Kelly report again on anything with data entry. We'll have Connie report on behalf of the current grant we're in, year 3, and some of those categories of carryover funding and sustainability, where we're at. We'll also get a quick update on the Health Link partnership from Connie. Connie also sent us, and I've included in our PowerPoint this morning, some information from county maps as we talked about the expansion of CDSMP. And then Connie will also give us an update on the application process as she's been working on that for the next 2-year grant. And follow up with, of course, our statewide training updates and any future agenda items that folks might have. So with that, I'm going to our first slide. This is what we've already done. And we'll hear from Kelly McCracken.
Hey there, and this will be quick. I really don't have any updates in regards to data other than to give some space to see if anybody has any questions or needs that they need from us.
Any questions for Kelly at this time? Kelly, will you be staying on the entire call?
Yes. So if anything comes up during the call, certainly, don't hesitate to ask. But, I just always like to give some space for any data-related questions and any things people might need in regards to data.
Okay, thank you. Also, Kelly, thank you for the edits on last month's meetings. We did make those changes.
Oh, great. Okay, thank you very much. I
wanted to acknowledge that. And the other thing I was just thinking of, Kelly, is I know a little bit later in our agenda, Connie will be sharing 4 different maps of some of the information that you may also have input on or comments on or questions may come up that you'd be helpful. So
great.
That could come up.
Sounds good.
Right?
All right. I'll be on. Thank you.
Thanks, Kelly. All right. So we are going to go on to Connie reporting on our current grant, year 3.
Okay, thank you. Lindsay Blackwelder may have sent out an email, or she may not have had time yet. I'm not sure, but one piece of good news is that I was told by our whoops, there's getting some feedback here, but
Yeah.
maybe from cell phones. But in any case, someone from contracting that can you all hear me?
Shoot.
I don't know if Monica, if that might be your phone.
Let me try to mute.
Yeah, that'd be. Oh, okay. Yeah.
Yeah, sometimes cell phones will give feedback, I know. You want to try that again?
Maybe that's better, yeah. Well, not a lot better, is it? Is anybody moving stuff around in the background, or aren't that many people on the call, so not quite sure.
Well, we can hear you.
Okay. It seems like it only starts when I'm talking. Wonder if it's my phone. It does start when I'm talking. That's weird.
Yeah.
Does it start when you're talking, Mary Pat?
Do you all hear it when I'm talking?
Yeah, I do. Well,
maybe do your best, because we can hear you somewhat.
Connie?
Yeah, yes.
Okay, this is Monica. I'm going to get off the call, see if it stops, and then I'll call back in and see if it comes back on, and then we'll go from there.
Okay.
Because it might have something to do with my driving or something, but let me do that and see if it stops that noise.
Okay. Okay.
Thanks, Monica.
All right. You're welcome.
Okay. Well. Shoot. I don't know what's going on. Should we keep going? I don't know if it's...
we can overhear you from the background noise. We'll just...
You can?
Yeah.
Okay. I'll talk a little bit louder. Maybe that'll help. But anyway, what I found out is related to the completers and classes and all that for this current grant year and the carryover funds, which were approved a couple weeks ago, is that we can include people that you've, classes that you've reached with grant eligible completers before the date of that option letter, which is basically a contract extension. And the reason is it's different from some of the time when we've talked about this, is that we have current contracts in place. They hadn't all been spent down, so there was still money available. And so in those cases, I guess a simple way to describe it is that they consider the carryover funding is sort of put in the same existing pool of money. So Lindsay Blackwelder can work with those of you who have done classes that you maybe met all of your numbers for the first contract we had in place, and then you reached additional ones before this contract extension was in place. Then you could work with Lindsay, and some of those will can still be considered for reimbursement for this year. In the past, at least most of the time, the problem has been that we had a contract that expired, and then we had an option, or well, there was a gap between when the timing of, like, so for example, last fall the grant year ended August 31st, and we didn't get something in place until October. So that gap in between, there was nothing in place. So in terms of a contract, so if something was done in September, we couldn't go backwards and reimburse for something before the contract was in place. But right now, we have a contract in place already, and this just kind of adds to that, like I said, pool of money. So that should be good news for those of you who did classes since you met your completers. And again, Lindsay Blackwelder will work with you all on what those exact numbers will be.
Good news.
Any questions about that? It's easier when there aren't that many people on the call, but not not so great about
not
communicating.
So
Yeah.
busy time of year.
Yep. Sustainability plan. We haven't finalized that. Basically, for me, I've been had 2 major deadlines since our last call, and I've basically done almost nothing other than those. One was the grant application, which was quite an endeavor, and then we have our state aid plan on aging that is done every 4 years, and I've been involved with some aspects of that, which is on a pretty tight deadline that overlapped our grant deadline, as well as a conference in DC and all kinds of fun stuff that happens at the same time. So we should have some more information on that by the next call. We will have more information on that by the next call.
So just to clarify, Connie, I think we can anticipate a conference call as well as a whole group separate from our collaborative meetings on the sustainability plan. I think
that's still my plan, yes. That's still my plan, yes.
Sounds good. All right. Anything else on our current grant?
Hopefully, no, just that with that clarification in the contracting and what we can pay for, hopefully that we won't have a problem reaching the number of completers for this year, which would be good news. And I guess that's it for now.
Questions anyone has for Connie on the current grant?
Hi, Connie.
Yes.
Hi, this is Monica. Did it work?
You know, it really didn't make a difference, Monica. I don't think it's your call. I don't think it's your phone. I don't know what it is. But.
Okay. Well, you know what? I'm going to go ahead and just get off the phone. And so I will touch base with one of you guys, and then I'll get information on what it was about.
Hey, let me ask a question, Mary Pat. Do you think it's worth, since there aren't that many anyway, calling back in and trying to see if that helps for everybody?
I mean, we certainly can stop recording. And
I don't think anybody's going to want to listen to.
Yeah. There's only about 5 callers on.
Okay. And you know what? I can barely hear you.
Let's try it, just because we've never had this problem before, and maybe there's.
Okay.
Would that be okay?
Okay. Yeah.
Hopefully no one will disappear altogether.
Yeah, it did just stop.
It just stopped.
It did.
Okay.
I'm noticing we're not getting that echo.
It looks like Susanna. Is Susanna still on the call?
Yes, I am.
Oh, yes. Okay. All right, well, just making that
it's
request.
A miracle. All right, let's keep going. I don't think we lost anybody. Okay. And if they do, they'll just call right back.
So I don't know who all could hear. You know, if you had anybody have any questions on what I just talked about, such as what did I just talk about, from what you could hear or not hear? Okay.
All right, then I'm going to move on to health links. I know it's a quick update there too.
Yeah, I attempted to get in touch with Lily and haven't heard back, so I'll need to do that. And then, like I said, with all the other things that I had, I didn't pursue again, but I will do that before the next call.
Okay. This might be a good place. I'm going to add a note that Meredith sent just this morning on email. And she had mentioned in our last meeting about developing a PowerPoint on the potential of partnerships with diabetes self-management programs. And she wanted to say that she also is continuing working on that, does not have that ready to go, but it was something she had promised to work on at our last meeting and wanted to acknowledge that she still has that commitment, but it's not ready yet. So I think we sort of segued into some other partnership opportunities besides HealthLinks, and so I'm going to interject that right there.
Sounds good.
Okay. All right, so in this section, Connie, I did download the four maps that follow this slide. So if you want to make reference, you let me know. And we'll click on.
This is just, there's four maps. The first two show, I did all of these for a grant application, and one of the questions is, since we had a grant before, and I'll talk more about the grant in a little bit, they're scrutinizing people who are reapplying as in two ways. One is, why do you need more funds, and what have you done so far that shows a positive track record? So that's why I was asking about if any, who all was going to reach some of those additional counties, if any. What I did is I went back and looked at the data from CDPHE to calculate or identify counties that appeared to have had at least one class by September 1st of 2012, which is before this current grant. And so according to the database, these are the counties where there had been classes up to that point. I don't know if there were classes way before that, but that's the data that was available. And you can see that that percentage was 55%. And then if you want to flip to the next one, then you can see a lot more yellow. And looking at, we're reaching more than I thought we were, which was 75%. Now granted, that could be one class in one county in 3 years, so it's not like we've really saturated the market. But as far as how we were counting that, just showed a good expansion, so I was happy about that. Any questions about either of those before we go into the next, which is a little different? Okay.
I don't think Crystal Ryder is on the phone, but I'm pretty sure they have reached Montrose County. So I've just seen that not yet marked, but that could be another county.
I went through the, I mean, it's possible I made an error, but I went through the emails a couple times. So, but, you know, it is possible that
maybe I'm just wishful thinking.
Yeah, I don't know.
Anyway.
Well, it would be good if we had.
Yeah. Okay. You want me to go to the next slide?
Yes. So the next two slides are information that I looked at for our current grant application. And Kelly had mentioned this slide last time. And so it looks like you can't really read the text on the right, but I believe this was related to symptoms, and Kelly can confirm a little bit more, but related to cardiovascular health. So it showed a lot of, I'm sure a lot of the conditions overlap with a variety of chronic conditions. But Kelly, could you just explain what the chronic disease quote burden means? Are you still there? We can't hear you. Kelly.
Was that a question for me?
Yeah.
Please repeat that question.
I was explaining a little bit about this map, saying it was related to symptoms of cardiovascular disease, and I wondered if you could just explain what the chronic disease quote burden means, the meaning of that.
Yeah, and that is on the bottom, or it's described in the text here on the slide, and I can't read that, but I'd have to pull that up here. Hold on just 1 second. This was put together by our staff here in our epidemiology and data.
I can read it. Well, I can read it to you if you'd like.
No, that's okay. I'll pull it up right now so I can kind of look at it while I'm talking.
I didn't know if burden, what I was getting at is whether burden took into account available services, or if it's just basically a calculation of the number of people who have those conditions.
Yeah, so what it's describing here is that the county scores were calculated based on the, there's 7 measures of cardiovascular health,
And I don't have those 7 measures. Actually, they're right at the bottom.
I can read them off real quick if you'd like.
Yeah, go ahead.
High cholesterol awareness, diagnosed diabetes, high blood pressure awareness, overweight or obese, physically inactive, currently smokes cigarettes, and exposed to smoking in the home.
So they took those 7 and then created a score, which is how this map reads, that the red are higher scores based on those burdens, and then the going down to green, which would be lower. And so for each measure, it says the county was given a 1 if prevalence was significantly lower than the state prevalence, 2 if it was the same, and 3 if it was significantly higher. And so the counties that you see in red, they had a significantly higher burden based on those 7 measures than the state average. And so that is how this sort of plays out. So the eastern, southeastern, and then you can also see Weld, Adams, and Moffett are in that significantly higher range in terms of chronic disease burden.
Okay. Okay, thanks. And then Mary Pat, you can flip to the next one.
Okay. Where's mine?
And this one is also, both of these are from CDPHE, and I have to say their data is very helpful in looking at some of the needs in different populations and, you know, diseases and all of that. So that was helpful to me in looking at identifying what we would want to target. This particular one is just shows adult prevalence, as you can see, of multiple chronic conditions, and some of it tracks some of what was on the previous slide about cardiovascular health and those conditions, but it does show in the southeast being high, and then kind of that's the kind of adobe tannish, brownish color with the hash marks on it, and then that same color without the hash marks, and then the yellow. So you can kind of see where it's southeast quadrant, really, and then kind of wrapping around the metro area, going up on the west side of the Denver metro area, and then that kind of El Paso, and then counties up in the northwest, and then counties that are kind of the southwest quadrant, with a little bit of an exception down in the, looks like Montezuma, Plata, Dolores, but counties. But I looked at this, I referenced this as far as areas that we would be interested in prioritizing if we are fortunate enough to get additional funding for the grant, and I can talk more about that. But what they're wanting for this next grant were 2 things. One is sustainability. That's a very high priority and probably a prerequisite, I would say, for getting any funding. And then the second was just expanding and doing something different, not just saying we're going to do more of what we already did and we want more money for it, but how are we expanding and, quote, bringing up to scale some of these programs. So I did try to address this based in part on this map and a lot of other research I did on what some of the conditions and populations are that have a particularly high need for healthcare for chronic conditions. Any questions on this map? Okay.
All righty. Thank you for sharing those maps. I think it's helpful information to see where our high areas of need are.
Yeah, and I actually hadn't read the CDPHE's chronic disease plan. Is that state plan for chronic disease? Is that the right name, Kelly?
Yeah, the chronic disease state plan. And I was just actually going to interject here quickly and say, I think it's fantastic that we're using these maps to plan where we may want to provide this type of service in the state in the future. I think it makes good sense to align it with these high burden areas. And I was going to offer that in the future, if you would like me to get our epidemiologist to be a part of one of these calls to talk about these maps in a little more detail, I am more than happy to make that happen. So just let me know.
Okay, great. Do you know if there's something on that chronic disease burden map that is not specific to like cardiovascular disease or particular disease or condition that maybe looks at chronic disease, all of the various kinds of chronic diseases that exist? I mean, I know that's probably harder to evaluate, but and that's why I kind of focus.
Oh, go ahead.
Sorry. I just, because when I saw it was related to cardiovascular disease, I didn't focus as much on this and as the next one that we just looked at, and that also was kind of more, it showed broader areas, so it seems like it'd be kind of a little bit easier to, well, I don't know if it'd be easier, but it did show sort of a more, it seemed like a little higher level and more expansive in terms of the kinds of conditions that we're looking at under CDSMP.
Yeah, definitely. So I mean, if again, if you would like me to have Renee or someone from our EPI section speak about this map of multiple chronic conditions, I'm more than happy to have her do that.
Okay. That sounds good. Thanks, Kelly.
Yeah, I'd be happy. I'm making a footnote here to look at that for the next agenda.
The thing I would be interested in is on that chronic disease burden map, is there one that's broader that kind of takes into account various chronic conditions, or is that basically the map that we are looking at, the second one? Because that seemed to cover a lot of ground.
Yeah, that's the second map you're looking at. The first map on chronic disease burden that focuses on those 7 measures that look at cardiovascular disease health, that was created for a grant opportunity that was interested just in that focus area. So, you know, when these maps are created, they're usually created for specific purposes. And so that cardiovascular disease map was created for that purpose.
Okay.
All right.
I was just started to mention the chronic disease plan, and that was that had a lot of good information in it. You know, I know people don't have lots of free time, but it was really helpful to me because it also mentioned a lot of populations that were high need, such as the African American community. They showed a lot in it, actually quite a bit more than the Latino population. And that showed some of the sections referenced a variety of populations, including Latino, but apparently African American, you know, they're high risk for diabetes, as Glenda I'm sure attest, and some other kinds of health risks. So that was one area that I included in our grant as a priority population based on that data. So again, Kelly, that was very helpful.
Oh yeah, no problem. And Mary Pat, I can send that chronic disease state plan to you to include with the minutes if other people are interested in taking a look at it.
Okay, that'd be great. We'll be happy to do that. Any other questions on this topic? Otherwise, we will move on. And we'll hear from Connie on what's going on with that second grant.
Yeah, and it was due Monday, so it was submitted Monday. And again, they were looking at those 2 criteria of sustainability and, you know, expansion, scaling up, that kind of thing. They also allowed for a third type of what they called self-management support program. So it was an option to include some other non-Stanford program that was shown to improve behaviors that are related to chronic disease self-management. So I proposed including something about an evidence-based behavioral health program, and they have to, if they select any programs that they select under that funding would need to meet their highest criteria for evidence-based programs as well. So that was something new, but it seems like, and this is, the programs that I looked at are not for people with a serious mental illness, but people that have behaviors that relate to the grant, such as depression, anxiety, other kinds of issues that translate to behaviors. But we'll see what happens with that. And in terms of the expansion and population, I looked at those geographic areas that were on the map that we just looked at, as well as some of the populations that I mentioned, such as African American, and then also the disease-specific classes. It seems like what some of the folks on the calls have said is that they are seeing those as a priority, and that they're easier to recruit for and easier to get completers for. And I can see why that would be, because if you think of, if you have diabetes and you hear about a class for diabetes, your ears perk up when you hear the word diabetes. If you have diabetes and you hear chronic disease, you may not pay attention to that. So, and it just seems like that's something that people are interested in, and it's something new, and would show expansion and concentration in a new and different area. So those are the areas that I focused on, and beyond that, if you have questions, that's fine. We don't know if we'll get any money. They can always give some, but cut back on certain things, so it could end up looking different. But I think I've mentioned before that it will be a very competitive process, because there currently, I think, are 22 states that have grants. They're only planning to issue 10 under this new grant announcement, and it's not just state agencies that can apply. So there may been additional entities like cities or nonprofits or whatever, so the competition could be greater than it was the first time. And I think they're also kind of scrutinizing, as I said, people who've already gotten a 3-year grant. Is, why do you really need more money? So I don't know that what they've said is, in terms of timeline, that it will be announced by September 1st. So I don't know if we'll get, I'm guessing if they are considering this, we'll get some questions in between now and then. And hopefully they'll make a decision before September 1st, since that's when or whoever whoever gets grants is supposed to start their activities beginning September 1. But beyond that, that's what we know at this point. Does anybody have any questions?
No. Fingers crossed. Yeah.
And when I said the Latino population didn't show up as often in some of the needs statements, that didn't mean that the Tamondo classes, I still listed those as a priority because it's something that's kind of more targeted, and it did show higher need than some of the Caucasian populations. So so that is still included as one of several priority areas to focus on.
Right. All righty. I'm going to move on then. So our next slide is showing the upcoming statewide training that we have a copy of in our posted, once again, is on our website, on the Self-Management Colorado website. These same opportunities are posted there. We've been able to add a couple that CU Health Center has added a cross-training in diabetes coming in September. Follows up immediately their 4-day chronic disease training, you can see. And then they also added a cancer thriving and surviving cross-training coming up this month. Oh my goodness, this month, June 25th. So the other ones that I added, we've got an opportunity, it's our 3rd annual implementing evidence-based programs in patient-centered medical homes. And in some conversation with Connie, we actually have some scholarship funds available for if anyone is interested in that. It's an excellent 3-day workshop. That Friday, June 12th, is really a wine and cheese reception, and then it's followed Saturday and Sunday, that's the 13th and 14th, by this implementing evidence-based programs in a PCMH. So we strongly encourage anyone, first of all, you're all welcome to the wine and cheese reception on Friday evening. It's free. It's at the Sheraton Denver West Hotel. And there's a lot of networking opportunities and sharing and meeting some of the people from a national level, as well as we will be featuring we call it a virtual tour, so it's a slideshow of interviewing some of our partners, providers, staff, and so forth, from best practices in a patient-centered medical home and how the referral processes are working for them. And so you're welcome to join us for that. We just need to know you are planning to come so we can plan on our food allowance. But then Saturday and Sunday are the workshop, and you can see, I hope, if not, you can certainly ask for this. But I'm going to send a collaborative email to everybody with this attachment, so you'll have it. But you can see some of the topics along the left-hand side that will be covered. It's really a great opportunity if you're looking to develop some sustainability and some partnerships with clinics and health systems that are PCMHs and so forth. You'll get a lot of good hands-on experience, or training, information, and so forth to develop those types of partnerships with your organization. And so, and you'll hear nationally what's going on and directions that are happening, as well as then sort of bringing it down to the local level. So we welcome you to join us. As I said, if you are interested, obviously it's next weekend, so we know it's a little bit short notice, but let us know. There is some potential for some scholarship funding. So we want to encourage that. And Connie, did you have any more on that you want to share?
Yeah, it looks like through our contract with COA, we'd be able to fund 50% of the cost of that, so it'd be $300. And the reason that I thought this, and Mary Pat mentioned this already, but just to reiterate, you know, with looking at how to sustain these programs long term, which is of course a priority for all of us, including our grant funding source, this would be a chance to learn a lot of what COA has been doing with a lot of success over the years, and getting the medical community on board with doing these classes and keeping them going in one way or another. And one is by some of them have committed to actually hiring and getting training for staff to become leaders, and of course that's a great way to get buy-in and sustainability. And then Mary Pat, will you be talking about the option for contracting with some of these medical practices to provide classes yourself?
Right. We'll include some of the different creative, I would guess, partnerships that we've developed, anywhere from that they just contract with COA directly to provide classes and pay for that cost, and all the way into that they have trained their own staff, they're buying their own materials, you know, they're hosting 2 to 4 classes a year, and we stay on as a license holder, obviously, but also as providing technical support and consulting and assistance, and how we finance that piece as well. So it kind of is that whole spectrum, and we'll share some of those practices and how that looks.
And I hadn't really thought about this as being applicable to everybody until I remember if it was you or Lindsay I was talking to, but it really seems like a great opportunity. And the idea of contracting with some of these, I think, might be appealing to clinics and practices and federally qualified health centers that may not really want to go to the effort of identifying staff, getting them trained, keeping them trained, making sure they get enough classes per year, etc. But if they contract with any of the license holders, that would mean maybe a smaller financial commitment, but still a great opportunity for the license holder to provide classes and get revenue for them, and offer a way for them to initiate and maintain the program with a smaller commitment. So I know, as Mary Pat said, it's short notice, but anyone who's interested, contact Mary Pat, and you can likely get a half of your tuition paid. And if you're coming from outside the metro area, we can look at whether we could fund additional travel expenses as well, because I know that's costly to be in a hotel for a couple nights and all of that. So let us know.
Any questions? As I mentioned, I will be sending out an email to everyone in the collaborative, so you'll get this information. I should do that by the end of today. That's just the flyer about the wine and cheese. That's hard to pass up on a Friday evening.
I'd like the positioning and size of the wine glass. It's always helpful for all of us to get food or drink. Oh, hey, can I ask a favor? On the classes list, there's a couple slides back, the training, could you provide the location? Because that, like you have Lakewood, but for CU Medical Center and the others, it doesn't say where it is.
Oh, yeah, it's at the Medical Center of the Rockies, and where that is that what you mean? I think that's important.
Yeah, if you put this, yeah, if you put that on there,
Gotcha.
I think that would help people, because they won't know if it's, won't know where.
Yeah, and if they go onto the website, they'll see the location too, but. Alrighty, yeah, this is just for our slide of the agenda, but all right, and then I just also.
Well, if people look at it though, I prefer to make it real easy for people so that they don't have to go somewhere else to find it. They can see it right there if that's possible. Sure.
And then also this, we do have that 2-day cross training coming up on chronic pain, and also have scholarship funds available for that. It is filling up. So we're looking forward to a real solid opportunity there. But if any of the other license holders, I know Monica has taken advantage of it, and she's sending 2 leaders. So if anybody else wants to take advantage of this 2-day cross training in August, let us know. We'd love to have you join the group.
And then we will also, we also have scholarship funding available for that. It's the cost, as you may have seen on the previous slide, is $325, so we can pay for half of that through the grant. And again, if you're coming from the outside the metro area, and if you would require an overnight stay, a lot of people wouldn't, but if you do, then you can let us know, and we may be able to reimburse for those travel expenses.
Okay.
Sorry to interrupt. I just wanted to make sure people knew that.
Sure. All right, so here is also an opportunity if anyone has any future agenda items. I think, dadgum, we got to offer that HIPAA. We got to put that on the agenda next month and be sure we address anything there. Any other suggestions that folks would like to see? This is a great time to give us some input.
This is Whitney. Quick question. That cross-training that you guys are offering in August, what are the exact dates on it?
The cross-training, oops,
Yeah.
I'll go back to it. It's August 20th and 21st.
Okay. We have one potential volunteer that was going to come to our training in September that can't make it to that one, and so I might see if he's at all curious about that one. So
sure, that'd be great.
Letting us know. Yeah, I'll keep you posted.
Is that Whitney?
Yeah, it's Whitney.
Yeah. Okay. Yeah, and I want to say that's a Thursday, Friday, if I'm not mistaken.
Okay.
That 2 days.
Yes, it is.
Thank you. Okay, good.
Oh, it's 2 days, so yeah. No problem.
Yeah.
I didn't look at that in terms of when I was talking about overnight stays. So anybody who's away is away may, be more likely to want to stay overnight. So.
That's over. Any other future agenda items that, and I'm just noticing that I spelled HIPAA wrong. It's H-I-P-A. Sorry. Well, just a reminder, of course, at any time that someone has a suggested agenda item, don't hesitate to email me and I will add it to our list. I did want to mention that Melissa, in her email that she regretfully could not attend, has the need for another master trainer in the diabetes curriculum for the Boulder area, and so she wanted me to put out an announcement for that. If anyone knows of someone who, particularly maybe Glenda or someone who has a master trainer that needs to maybe stay certified and or might be interested in co-leading, I'm assuming with Melissa, in Boulder, it would be in late August. She hasn't set the dates, but would like to capture another master trainer for that, as well as if you do have any trained leaders in the Boulder area that might be interested in leading some classes for her, to let her know. And I'm sure that would be in diabetes or the chronic disease self-management. She also does Tamondo classes. So I think she's just looking for access to a few more leaders. If you, as a licensed holder, have anybody in the Boulder area or someone who might travel to Boulder, let Melissa know.
Lindsay, this is Tanika Ship with the Center for African American Health. Can you guys hear me? Okay. So I was just trained as a master trainer for CDSMP for chronic disease, but in order for me to really be trained and receive my certification, I have to teach 2 chronic disease self-management classes. So I would be willing to go to Boulder if there are chronic disease self-management classes that she needs a co-leader. I would be willing to go to Boulder and get those so that I can take the cross-training to do DSMP.
Right. So and as I understand the requirements as a master trainer, I know you were just out in Massachusetts with Kelly. So you are saying you'd be willing to do a in-user class, a 6-week class, in chronic disease self-management, so that you can complete your certification process for a master trainer.
Exactly.
Okay. I'll let her know that. And you need it in the chronic disease, not in the diabetes at this point.
Right. I need it in chronic disease.
Okay.
Yeah. So I could Boulder and get that done. And anyone else in the collaborative action. Yeah.
Awesome. I will let her know.
I
will definitely let her know you'd be willing to do that.
And was that Tanika?
Yeah, it was Tanika from African American Health Center. So I've been referring to Glenda.
I've been on the call. It's just showing that I'm Glenda, but I've been on.
Yeah, that's what happens. It comes up on my roster as Glenda Mitchell, so we're going to correct that. Thank you.
And Tanika, and this is Connie, we may have talked about this before, maybe with Glenda, but if you want to get that diabetes cross-training before August 31st, let me know and we can see if we can use some grant funding to support half of that cost for you. Okay. While we have it available, because after August 31st, I may not have any opportunity to do that.
Oh, okay.
All right, good. Any other comments, suggestions, input?
I'm sure I'll have more agenda items, but I can get with you later about those.
Okay.
As time approaches.
Sure. So our next meeting is posted for Thursday, July 9th. You'll see that is the second Thursday of July because the first Thursday is July 2nd, and I know myself and some others may be on a holiday weekend, so we are pushing it back 1 week for Thursday, July 9th. And I will send out a reminder on that, especially since it's a little different. And other than that, that's all we got.
I hadn't looked at that date. I may be out of town then. So if I am, I could give you something in writing ahead of time.
Sure.
If that sounds okay.
For July 9th?
Yeah.
Okay. Anything else, anyone?
Hi, Mary Pat. This is Kelly. I just wanted to let you know I don't think I have any reoccurring CDSMP meeting invites on my calendar past this month, so I don't know if that's true for others.
Yeah, you're right, because we did it.
Yeah.
I did it up to June because it was the first Thursday, and I could do that as a mass email. So you'll get a separate one for July, and then I will do another mass email for the rest of the year.
Awesome. Thank you so much.
Yeah, you bet. It's mainly because I could not figure out how to interject one that was different. Thank you for bearing with me. I think that's it, everybody.
Thank you.
Cool day as best you can today.
In more ways than one, huh?
Yeah. All right. I am going to stop recording. Thank you all.
Thank you so much.
Thank you.
Bye-bye.
Thanks.